with either option, there's got to be, advantages, disadvantages, or maybe some challenges that comes from, starting a practice versus joining a group practice. What might some of those be?
If you're someone who really values your autonomy and you value being able to set your own schedule and not having to report to anyone, those are all predisposing factors where a private practice or solo practice would make a lot of sense. And in general, from population data, we know that people who work for themselves are significantly happier than people who work for others, with the asterisk that as long as you're making enough money to support yourself, that all things being equal, people tend to be happier when they're their own boss. And that's for a lot of the other reasons that I just mentioned previously. If you've got that personality and don't like answering to other people and don't like having to be available for your job from 9 to 5 or 9 to 6 with a mandated, 1 hour lunch break, that's all stuff to consider a private practice. The goal is hopefully that a lot of the tasks of running the business are simpler now than they were a long time ago. From accounting to payroll to benefits to an EHR that can do some of the billing and claims and collections for yourself. So I think the entrepreneurial spirit level that was required years ago is much lower now. And I would highly recommend anyone that has enough tolerance, enough little entrepreneurial spirit spark, but that really wants the control that comes from being your own boss and running your own practice, then you should go for it.